Go, go. Why, it's another beautiful Saturday. Good evening. Good evening. It is 4 p.m. here, right here in PEI, Canada. And my name is Rosemary Henriese. How are you all doing? Welcome to another beautiful therapeutic. I like to say it's therapeutic because it's more what we do on the Young Women and Wives Burdens and Blessings Initiative discussion platform is that we are more concerned about the woman and her wholeness. Welcome to another beautiful Saturday. Like I said earlier, my name is Rosemary Henriese, coordinator for the initiative, and I would like to ask, how have you been? How are you doing? How has your week been? Family and everyone. The week has been pretty busy for me. I was just saying to someone today that I had a lot of things that I had to do. My hand was full. My hand was busy, and it's worth it. It's been worth the busyness. Thank you so much for joining us. And tonight is a very sensitive, and if possible, it will actually be emotional, as we are looking at a very unique topic. Unique topic in the sense that it's a topic that I myself, when I decided to look into it, I'm like, oh, I never knew that such actually looked at or considered even when it comes to children. So this evening we are looking at the topic mental health of our children and our teenagers, the early signs and how to support them. Okay, I am not the host for the month. The legal advisor of the initiative, in the person of Barrister Kenny Ifije, is our host for the month, and I'm going to be bringing her in on camera so she could take over from me. You know, the video where I said that we really, as parents, we are really pretty occupied with our kids and concerned about kids and grades and all that. But and then we take that into we make those things grades, gadgets, oh, the future, everything, but we do little or nothing when it comes to their health, or you know when it comes to their health, their mental health especially, which is at the core of the existence of any human. So this night we'll be looking at the mental health state of our children and our teenagers. What are the early signs, and how do we support them? How do we support them? Barrister, good evening. Welcome.
Good
Thank you
evening,
for being
ma'am.
here. How has the
Evening.
week been?
Very fine, thank
Oh,
you.
good to hear. Okay. Our speaker is not here yet, I believe. Not.
She's on our page, the Young Women and Wives with
Oh, she's
Burden.
supposed to come to this
Yeah,
personal page.
so I'm sending her a message now.
Oh, okay, okay. Mommy. Okay, and as our custom is, please, as soon as you come online, tell us where you're joining us from. Tell us where you're joining us from. We'd like to. Apologies. I'm out of my comfort zone where I usually have this program. So you're going to be hearing a lot of voices and all that. Apologies, please forgive me.
Yeah.
Forgive me. Okay, but
Just give me.
Barrister, you can go ahead, please.
All right.
Yes.
Just give me a minute. I just want to just keep
Okay.
talking. Give me a minute.
Okay. Um, so when we look at this type, when we look at mental health, the most popular, the adult version of mental health is what we all talk about. We all talk about mental health in adults, and how every adult is battling mental health, and then we do a shove to children's mental health stage. You're like, oh, what is the child thinking? What responsibility does the child have? What to talk about, speak of mental health. However, for in as much as they are human, it is of importance that we look at, all that concerns them. And on this platform, what we do is we try to help the woman. We try to
Okay,
help the woman become
she's
the
joining now.
best of who she is. Okay, barrister.
Yes,
I
ma'am.
think I've seen her. I can bring her in now.
Yes, yes.
Okay, I'm bringing her in. So please go
Okay.
ahead.
All right. A beautiful evening to everyone, and thank you, Alcovina, Mrs. Rosemary Henry. Thank you all. I'm sure it's been a wonderful weekend, and a big thank you to our guest speaker today. Um, Before we start, I'll just read her biography, and I think our convener has given a brief introduction of what we're going to discuss today. So I'll quickly read her biography. Um, Doctor, today in today's section, we have Dr. Merit Aigbokhai. She's a passionate and dedicated specialty registrar in pediatrics at the Shrewsbury and Telford NHS Foundation Trusts in the UK. She's a committed clinician, mentor, advocate for child and adolescent health with a long-term goal of specializing in pediatric cardiology. Please don't mind my tongue. Born and raised in Ekpoma, Edo State, Nigeria, Dr. Merit began her academic journey at Zana Primary School and Ambrosali University. She later attended the university where she earned her Bachelor of Medicine and Bachelor of Surgery (MBBS) degree in 2014. From an early age, Dr. Mary developed a deep passion for child health. Even as children secondary school, as a children's secondary school student, she often told family and friends that she was determined to become a pediatrician, a dream that continues to shape her career today. After completing her internship at National Youth Service Corps, she successfully passed her primary fellowship examinations of both the National Postgraduate Medical College of Nigeria and West Africa College of Physicians, paving the way for her pediatric training. Determined to support other young doctors, Dr. Merritt found a West African pediatrics discussion group on Telegram, helping trainees prepare for their postgraduate fellowship exams under her leadership. The group achieved an unprecedented 70 to 80% success rates compared to the previous average of 20 to 30%, significantly impacting pediatric training outcomes in the region. In October 2021, she achieved another milestone by passing her Part 1 fellowship exams, earning membership in both West Africa College of Physicians and the National Postgraduate Medical College of Pediatrics and Child Health. With a vision to broaden her expertise and gain international exposure, Dr. Merritt pursued further training in the United Kingdom. She successfully completed the required qualifying exams, relocated with her family in March 2023, and began working at the Shrewsbury and Telford NHS Foundation Trusts. Remarkably, within her first year in the UK, she passed 4 major pediatric examinations, becoming a member of the Royal College of Pediatrics and Child Health (MRCPCH) in 2024. Wow.
Wow.
Today, Dr. Merritt works as a specialty doctor in pediatrics, where she is highly regarded for her dedication to patient care, teaching, research, and quality improvement projects. She actively mentors junior colleagues, participates in clinical audits, and is a certified good clinical practice researcher. Dr. Mary's passion for children's health extends beyond the hospital. She's the founder of Marital Foundation for Child and Adolescent Health, a non-profit organization committed to supporting critically ill children from underprivileged backgrounds. Through the foundation, many children have received life-saving care and financial assistance for urgent medical needs. While there have been a few heartbreaking losses, these experiences have strengthened Dr. Mary's resolve to improve access to quality health care for vulnerable children in Nigeria. She's a devoted lover of God, and over the years, she has served in numerous leadership roles within Christian organizations, including Assistant Hospital Unit Leader, Living Faith Church, Ekoma, Editor-in-Chief, Christian Medical and Dental Association, Ambrosali University, Assistant Leader, Gilead Unit, Living Faith Church, Pansia. Her leadership also extends to the medical field, where she has served as Vice President, Ambrosali University Medical Students Association. She's also served as a Welfare Secretary, Association of Resident Doctors, FMC Yenegua, Welfare Secretary, Medical Women's Association, Bayelsa State. Dr. Mary continues to mentor young doctors and medical students, guiding them academically and professionally. Outside her medical career, Dr. Mary enjoys reading, watching movies, dancing, creating inspiring content on social media, and spending quality time with her family and friends. She's happily married to the love of her life, Dr. Okaide Aigbokhai, whom she met during medical school. Together, they are blessed with 3 wonderful children. Dr. Merritt's journey is one of passion, resilience, and purpose. From her early dream of becoming a pediatrician to her achievements in Nigeria and the UK, she has remained steadfast in her commitment to improving child health, mentoring future doctors, and making a lasting impact through medicine, philanthropy, and faith. With our hands put together wherever you are, let's welcome our guest speaker, Dr. Mary.
That is like 10 minutes. Marisa, summarize next time, oh.
You know, I said, which one? I said,
You
which
have
one
said
will
all
you
the time
take
that we
first?
need to ask her questions now. Summarize next time, oh.
I was thinking of which one I would take her, but man, it is
No, there's a
fully
way you
loaded.
summarize it,
Don't
no,
worry,
but
don't
because
worry, don't
it is
worry,
really
don't
loaded.
worry, don't
Welcome,
worry.
doctor. It's good
It's
to
fully
have you.
loaded.
Yeah, thank you very
Okay, it's good
much.
to have you. So please carry
Yeah,
on.
all right, Kami, thank you very much for that wonderful introduction. Yeah, it was indeed long. Thank you. Um, it's actually a great pleasure to be with you, this wonderful family, the young women and wives of Boarding and Blessing Initiative family. It's actually a wonderful pleasure to be here. And also, it's a great honor to be invited to speak on the mental health of children and teenagers. Um, as a strong advocate for children and teenage emotional and mental health, I feel very honored to speak on this topic. And as a mother who have children, I've got 3 kids, like Kenny had rightly said, and I work in a setting where I see children on a daily basis, work with children on a daily basis. I see the struggle and how difficult it is to raising children. And you calling me to speak on this topic is actually a good one. I want to commend the founders of this group, Mrs. Rosemary Heriese. Thank you for founding this great group that is giving support to our women, giving support to our wives. Also, thank you, Kenny, for inviting me to do this. Thank you very much. So today, like she already said, I'm going to be talking on the mental health of children and adolescents, spotting their early signs and also supporting them. Okay, so in starting, we have to understand what mental health is. So, what is mental health? So, mental health is not just a state of wellness whereby we do not have illness. It also touches other aspects of life. So, it touches how a child feels, how a child thinks, how a child responds to their environments, how they relate to others. So this is quite different from mental illness. So mental health illness is the opposite of mental health. So when there's an illness, there's a deviation of how the child is thinking. There's a deviation of how the child feels. There's a deviation of how the child relates with their environment and how they behave around people. And so when there's that deviation, you start searching what could be wrong. Is this child depressed? Is this child having anxiety problem? Is this child having bipolar disease condition? Is this child having psychosis? There are various types of mental health disease. So you try searching what is actually wrong with this child. Okay. And the next thing I'll be talking about is the common causes of mental health challenge. This I'm going to say something about raising up children. The Bible says in Proverbs 22 verse 6, raise up a child in the way they should go. So this topic is going to be around how to raise mentally well children. So raise up a child in the way they should go so that when they are grown, they will not depart from it. So this extends to their emotional well-being. This extends to their mental well-being. So it's not just about training them, putting them in school. They go to school, they wear good clothes, but how are they emotionally? How are you supporting them? How are you responding to their verbal and non-verbal cues? Okay, so I'm going to be talking on the common causes of mental health disturbances in children. The first one will be family challenge. Another family challenge, I'll talk on divorce. Studies have shown that children who grow up in a divorced home struggle a lot with mental health issues. Imagine a child probably between the ages of 7 and 14 years, all of a sudden, the support system he's used to or she's used to suddenly gets distorted and there's a shift, and it's no longer balanced. So father is in another place, mother is in another place, and this child has to shuffle between the two of them. The child does not even understand what is going on. Everything is like clashing in his or her head. So that child is more likely going to suffer from mental health disturbance. They are going to suffer from anxiety. They are going to suffer from depression. Also, parental conflicts. We'll see family these days. Mother is saying one, father is saying the other thing. And they are fighting before these children, quarreling, shouting. And the other day on social media, I saw a father beating the mother mercilessly. And then the child was saying, Daddy, stop, Daddy, stop. Tell me, how do you expect that child to grow? Think that child will grow up and be mentally sane? No. That child is going to suffer a lot. There are different things that will go on in the child's head. It might be anxiety, it might be depression, it might be withdrawal, but that child is not going to grow up the same, watching that same. Okay. Another thing would be mental stress. As parents, God gave us his children to support them, to give them, to provide for them. But by the time as parents you are unable to meet these demands, a lot of demands. These children, they're looking at like, oh, what's going on? I can't get this. I can't get this. Mom, give me this. I can't get this. A time will come in their life, especially during teenagers, they start feeling they need to step up and take up the responsibility of their home. And that anxiety, that pressure is on them. It can affect their mental health. And most of them deviate, decide to do whatever they want. Some girls will go into prostitution just to make sure they raise money to support their family. Some boys will go to cybercrime, do a lot of things just because they are taking responsibility that is not their own. So this can affect any child's mental health. Another thing will be school pressures, exam pressure. Okay? Exam pressure cannot be overemphasized. When I was in medical school, I saw a lot of people suffer mental health disturbances because of exam. Some had psychosis, some got withdrawn, some left, went to get treatment, came back, but they were unable to complete it. That pressure of, oh, I need to pass this exam, I need to do well, can override somebody. And, sometimes the pressure can even come from the parents. You must pass this exam, you must pass this exam. And we've seen a lot of youths, a lot of teenagers killing themselves because they have failed exam. There was a young boy then who went and jumped into the river because he failed an exam. okay, is another cause of mental health disturbance. I remember when I was in SS1, as a young girl, I was always motivated. I want to do, I want to read, I want to read. But then when I was in SS1, there was this teacher, his name is Ajo Maliki. He teaches government. And what he likes is replicating his note in exam. Like, give me what I taught you, like word for word. Like when he asks you question, it has to sound how he taught you, So I took up my book. I started reading. I read his book, memorized everything, like word for word, down to the latter. On examination day, I got to the exam hall and things started clashing in my brain. I'm not sure I knew what was going on. But I tried. I answered the question, but I wasn't comfortable. So I got home. I just sat down. I don't know what happened afterwards. It was the next day they were telling me what happened. So what happened was that what they said was that as soon as I got home, I told them I was tired. I sat down on the chair and it was like I wanted to sleep. Before they knew what was happening, I started saying things. And what was I saying? Everything about government, answering all the questions on government. And they started pouring me water. Do you understand? They pouring water, started praying. Oh, at the end of the day, but I got better. So what I'm trying to say is exam pressure can actually cause emotional disturbance. It can affect children. So we as parents will have to be careful. I'll come to that later on how to handle these things. Another thing is bully. These days, I don't know what is going on, but there is bully. And when children get bullied, it affects their self-esteem. It affects how they see things, and they get withdrawn. They start having anxiety. Some get depressed, and it affects them psychologically. Another thing is social media. Social media, I don't know, it's like a pandemic. It's eating deep into this generation, and it's a whole lot. And some social media naive ones goes there, sees all the teenagers who are already manifesting online, and they start having this comparison. Oh, I'm not as beautiful as this girl. Oh, I'm not slaying as this one. And they start having this poor, low self-esteem. It starts affecting them psychologically, and they start having some mental health disturbances. Okay. And also studies have shown that social media causes a lot of anxiety problems. Okay. Another thing is identity struggle, peer pressure. One's friend is smoking, and then the other one is like, oh, I have to look like James. James smokes. Let me try it. And James passes the cigarette or the cannabis or the cocaine. Try it, John. Try it, John. And John picks it and smokes, and then his head goes gaga. He goes crazy. He starts having psychosis. So peer pressure is always there. Or trying to fit in. I want to fit in. I want to be friends with this group. You have just, maybe the child has just started a new school and there's this group. Oh, I want to be there. And because they are trying to fit in, and maybe they are not meeting up to demand, and before you know what's happening, it start affecting them emotionally, and they start getting withdrawn or they start getting depressed, most especially if they don't have what the other kids have. Self-image. Some people might be on the big side, and because they are fat, it starts affecting them. And probably people in school are saying, oh, you're fat. It can affect them psychologically. Another thing is trauma, loss, bereavement. Imagine a child that has just lost a parent. That parent has been their backbone, has been their support. How do you expect that child to survive? It's going to be a whole lot. It's going to be emotionally demanding. It's going to be, I'm going to come down to questions later, okay? It's going to be emotionally demanding. It's going to be terrible on that child. There was this lady I saw, she was just writing her experience on social media. She said she was 7 years old and her dad died. And her dad was like the rock of the home. And suddenly the mom went into drinking. Mother was drinking and drinking, and she drank and died this girl was now 14 years. Imagine that girl, how she'll feel. She said she suffered mentally. It was a whole lot to take in. Until today, it's still affecting her. She's grown, she's now an adult, but it's still affecting her immensely. Okay? Another thing is relocation. When people suddenly just relocate, it affects children. It affects children, indeed, yeah. So we relocated from Nigeria and we got to the UK. First of all, we got to this city and we're staying in this city. But then the school close to the house, we couldn't get in because they do all this, the school was already full, there's no space. So they took my children to school very far away. So 2 months later, they found space in the school close to the house, and my children had to come to the school close to the house. So they are now attending this school. And then I got job in another city, and I'm moving to another city, and I'm telling my children we are going to change school again. And my daughter was like, "Ah, mommy, changing school again. How am I going to start? I need to make new friends." It was affecting her. My son was like, "I won't see my old friends again." But if there was no support system in place to let them know that, come, you're going to be fine. Do you get? They would have suffered. So it affects children a whole lot. And that was why when we were about trying to get our own home, my husband was like, "No, we have to get a house very close to their school. Even if we have to travel miles away to get to work, the children has to be stable so it doesn't affect them psychologically and it doesn't affect their mental health." Another thing is abuse. Abuse, any form of abuse, physical abuse, hitting children as parents is not advisable. Sometimes they're always very stubborn. I have to hit him. It's going to affect them psychologically as well. Abuse, sexual abuse from anywhere is going to come from. Most people, even at this adult age, if they want to tell you what they fight, the demons they are fighting, they'll tell you is the sexual abuse they experience at so and so and so and so age. I remember there was one lady that came not too long ago and was explaining, oh, the abuse she went with her pastor, how it affected her. People don't heal from these things. And it can affect them even into adulthood. So these are the things that could affect children, that could mess up with their psychological health and their mental health. Another thing is excessive screen time. Our children these days is screen. And we do not say anything because they are not disturbing you. You have allowed them. They are just there, well focused, looking, watching. And most times you're not even paying attention to what they are watching. You don't even know what they are watching if it's something that is affect that can disturb them psychologically. And at the end of the day, they become anxious. They are getting depressed because they are so obsessed with this and they can't even do without it. Now, what are the early signs? How do you know that this child is beginning to have disturbance with their emotional health or their mental health? How do you know? Emotional signs. Suddenly, a child who is always joyful, happy, start getting withdrawn, becoming sad, crying frequently. You should know something is going wrong. Don't get me wrong. There are times people get sad. There are times teenagers cry, especially adolescents. They are filled with so many hormones. Their hormones are raveling. But when it's something that is persistent, you should know that something is going wrong and you have to look into it. They are extremely moody, you have to look into it. Or they are irritable. Any little thing they shout, "Come on, get out! Don't talk to me!" You should know something is not right. Or they're having this anger outburst, becoming aggressive, becoming violent. You should know that something is not right, something is wrong, and you have to look into it. Or a child who previously enjoys football, all of a sudden you're telling, "Are you not going to go practice today?" "I don't want to go." Or a child that likes dancing and goes to dancing practice, all of a sudden doesn't want to dance. When they start getting withdrawn such that they are no longer interested in their previously enjoyable activities, you should know that something is going wrong and you have to look into it. Or suddenly their school grades start dropping. A child who was doing excellently well before, all of a sudden their school grade starts dropping, they're no longer doing well. You have to look into it because something is obviously wrong. Or a child who probably sleeps by 9 p.m. before, and you go to this child's room, this child is on the bed and has not slept by 12 a.m. There's problem going on. The child is not sleeping, or the child is waking up, or the child is just sleeping excessively. Throughout the night, the child has slept. During the day, again, the child is not wanting to go to school. The child is sleeping. There should be something going wrong. You should know that something is wrong. Or low appetite. This child does not want to eat. You're even forcing the child to eat. The child does not want to eat. And this is a child that usually loves food. There's something going wrong. Or the child is coming, frequent headache. Go to school, I'm having headache. Go to school, there's stomach pain. You know that something is going wrong. And as a parent, you have to look into it. Now, how can you as a mom, because this is more of the women group, I don't know if men are there as well, but then as a parent or as a mom, How do you handle your children? What do you do? The first thing I'll say is to create a safe space for communication. Apart from being a parent to your child, let them see you as a friend, someone they can talk to, someone they can trust. And when you're asking them question, ask them open-ended question. Find out what is going on. How was school today? Who is your friend? That's what I always do. Do you have new friend? Tell me about your new friend. You are asking them questions. You are involved in their life. You're communicating with them. You are talking. So at the time when something starts going wrong, you'll be the first to know that something is not right with my child. Because this is your child. You guys have been communicating. You guys have been friends. Learn to boost their confidence. Learn to boost your child's confidence. Let them know that they are the most beautiful, the cutest. I always tell my daughter, you are so beautiful, African princess. Ah, see how fine you are. I should just be happy. Your skin is so beautiful. Why? Because she has so many white girls in her class, and she's like maybe one or two black girls in her class. You have to boost that self-confidence. Let her know that her hair is beautiful. Because one day she was like, Mommy, why my hair is so short? I said, don't worry, you have the most gorgeous hair. Boost their self-confidence. Let them feel it. Because even when other people say it out there that, oh, you are ugly, it won't get to them because they know where they're coming from. Someone is letting them know that, see, you're fine, you're this, you're that. So I'll give this instance. My daughter came, she was complaining, she's complaining that Mom, they don't always pick me. When I raise up my hand to us, they don't pick me. And she was like, it was getting to her. So I thought of it, and I think there was something I watched something saw something on Instagram about a mother how she handled her child. So I decided to use that same method. I got flowers, I got petals, I got rose, I got tulip, I got sunflower. I brought them together, and I called her. Michelle called me. She came. Pick your favorite here. And then she picked the sunflower. I said, do you like the sunflower? She said, yes. Why do you like it? Oh, it's yellow. It's cute. It's this. Okay. I dropped it. I said, drop it. Now look at the rest flowers. Does it mean these flowers are not beautiful? She said, they are fine. They are okay. For the fact that you didn't pick this flower, does it make these flowers less beautiful, less attractive? She said, no. All right. I, on the other hand, can decide to go for rose. That does not mean sunflower that she picked isn't beautiful. So I use that to boost her self-confidence. I let her know that, see, for the fact that they did not pick you does not mean you're not good. Does not mean you're not beautiful. Does not mean you cannot stand at pars with everybody. It means at that point, the teacher probably wanted to pick that particular person. And that does not make you less or make you less than that person. She saw it that way, and after then she stopped complaining. And most times, oh, do they pick you? Oh, yeah, they pick me. She doesn't complain about that again because she has come to understand that for the fact that they don't pick me does not mean I'm not good enough. I'm not beautiful. So learn to boost your children's confidence. Is going to help them in the long run. Now, avoid conflicts at home. Avoid conflicts as much as possible. I know, maybe we are married. For those who are not yet married, I will advise, know your partner, study your partner, check if you guys have character compatibility. If it's not there, it's not there. Look the other way. It's better to marry right and avoid divorce and conflict than marry wrong and within 1 year you're out. It's not about, oh, let me get married and be a missus. No. Marry the right partner such that you know that when he says A, I understand his A. When I say B, he understands my B. You both understand each other. That you won't get home and there's conflict, there's quarrel, especially in front of children, because it's going to affect them immensely. Try as much as possible. And you're already in the marriage, it has happened. Then you have to try as much as possible to hold your home together. Try to know what gets your partner angry, what can make him, just try as much as possible. I'm not advising to stay in an abusive marriage. I'm not advising to stay in an abusive relationship, but try as much as possible to put things under control. Okay? So that these children will emulate good character, good behavior. Remember I said train up a child in the way they should grow. So as you're training them, they are looking at you because you are their role model. Do you get? So you have to try to act right before them. Now, be financially stable. It's very important. It's not good that as a parent you are sitting down at home, you are satisfied, or probably, oh, I want to become a teacher. Bam, you are a teacher, I'm not a teacher, and then you just settle down in that teaching. You do not want to move forward, you do not want to progress, you do not want to work on yourself. No, 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 no. I'll use myself as an example because I've graduated, I'm now a doctor, I'm now working. I would have said, oh, now I'm earning up to 400,000 a month, let me just sit down. But then I didn't see it that way. I'm always like, what next should I do? How should I better myself? What is the next step? How should I move forward? Okay. When I was in Nigeria, I was not meeting like, how many things will I count that I'm unable to do with that money that I was earning? I was still struggling. You need to buy basic things. I'm going to write a list. Write down my list. Oh, and looking at it, what can I take out when I'll get to the store and they are saying tin of milk is probably I wrote 1,000 and now they are saying tin of milk is 1,2. It's disturbing my head. Or oh, I'm going to buy fuel today. When I'm looking at all these logistics, trying to cope with all this financial, pressure, trying to pay school fees, trying to do this, I knew I had to step up. I need to do something. So don't get comfortable where you are. Try to get better. No matter what, just you keep growing. You keep growing until you die. Just keep growing. Try to take another step. Try to take you've achieved this financial stability. Move higher. Don't get don't just get comfortable in one position. Be emotionally present for your children. This time around, I'm going to say, mothers, stay away from social media. Most mothers these days, they're on Facebook, Instagram, they are not doing TikTok. They are not present in the children's life. They don't even know when their children are crying, they don't even know children are crying. When the children are happy, they don't know children are happy. So I'll say, mothers, please stay away from social media as much as possible. I'm not saying totally, but you have time. When you're with your children, you're with your children. When you create your own time to do that, you create, but be emotionally available. Let your children know that there is a support for them. There's someone who is looking after them. Okay. And then also this time around is you monitoring the children's social media. Don't just allow them go. Once again, train up a child in the way they should go. You have to set boundaries. You have to set rules. In your home, what's the screen time like? Excuse me. You can say, oh, children, when you come from school, this is what you do, this is what you do, no screen. Or weekends, I'm going to give you screen time 2 hours. But then you try to set boundaries and set rules. If they've got their tablets, then you install parental guide. The parental guide, what it does is, oh, this is what they watch. If you do not approve it, they can't watch it. This is the time they have to watch it. When that time elapses, it shuts out on its own. You have to put these things in place. Otherwise, you will not be able to help your children and they can get lost in screen and it will affect them psychologically. And then for those who their children are already having challenges, are already seeing the signs, you have to seek for professional help. That's not the time to say, oh, I'm going to church, I'm praying, I'm praying. Fine, it's very good to pray. But science and medicine, science and faith are not enemies. They are together. They work synergistically together. While you are praying, seek help, seek support for that child. Okay? And it
Thank
could
you.
be faith-based support, hope support. You can take them to church if you're a Christian. You can take them to mosque if you're a Muslim. Or is it a community support? You have to support that child. All right. So
Thank you.
okay. Okay, so in a nutshell, there are early signs to mental health problem. You have to look out for this early sign, check it out, and try to support your child as much as possible. And when you see something is not right, you try to be involved more in with that child and try to seek for professional help. All right,
Thank
thank you
you.
very much. Yeah.
Thank you, Dr. Mary. Thank you so much. It's been a very, very, very informative section. We've enjoyed every bit of it. I think Mr. Henry Chimela, he asked a question. You talked about social media. He talked about the impact it has on our teenagers and young ones now. And he said, how do you control these social media issues? How can we parents control the social media issues? I know you've talked about it, but elaborate more.
Okay. So with social media, like I said, especially I think for social media now it has to be with the teenagers. So they're already there and they are trying to explore. There's this lady, I don't know if you guys know her. She's an actress. Her name is Bisola. I think not until her child was it 16 years or 18 years, she didn't give the child phone. So she decided to take that route. Do you get? So she decided not to expose the child early to social media. Like I would say, train up the child in the way they should go. Because if you start training your child early, your child listens to you and you already set boundaries and set rules. So that is on one hand on how to look at it. Another thing you can do is parental guide. As far as this child is still under you, you can still set up parental guide on their phones just to check what they are doing. Okay, so that's another one. But if you can't do parental guide, speak to your child. Be open with your child. Let them know what is happening. Let them know what is at stake. Communication, father and child. Your child sits down, let them know this is the ill, this is the ill, this is the ill. If you do this, this is what it is. If you do this, communicate with that child. And I believe when you do this, it will help. Okay, so communication, set parental guide, set boundaries, and I believe that will help.
Thank you so much. Thank you so much. Please keep coming, send questions. Our guest speaker, she's fully loaded. I have a question for you, Dr. Merritt. Um, you've worked with children for so many years now, and from your professional perspective, how can parents distinguish between normal developmental challenges and then the early warning signs of a mental health difficulty in the child?
Okay, that's a
How?
very good question, Kenny. So in my teaching, I already said this, but I'm going to emphasize again. Okay. So how do you differentiate between normal developmental attitude from mental health crisis? Now, especially adolescents, like I said, they have these hormones. They are trying to understand things, trying to get used to their body. Suddenly there's breast, suddenly their voice is changed, there's hair. So all this hormone, they are unable to manage it. And at that point, they start struggling with their mood. Sometimes they're sad, sometimes they're happy. But then the difference. So if they are sad, do they come around after a while? Does it last forever or is just for a short period? If they throw tantrum, do they come around to listen to you and do what you've asked them to do? Is it short-lived moodiness? So all this, when it's short-lived, their tantrum is just something that, it goes on and it goes hot and it goes cold. They're able to come around, they're still happy around you despite that. That's normal adolescence attitude. But then when it comes to a point whereby this child is sad, sad today, sad tomorrow, 1 week, this child is still sad, or this child is just crying every day, or this child is becoming violent, becoming aggressive, scattering things, you should know that something is wrong and you need support and you need help. So that's the difference.
Hmm. Thank you so much. Thank you so much. Someone said, can we classify YouTube as a means of social media? Yeah, yeah. We can
Yeah.
hear you. Okay, yeah, yeah.
Okay. Yeah, social anything that can, impact you socially is social media. So that's what social media is. So if you go to YouTube and you watch something and it's impacting and influencing you, it's social media. So it all depends on what they go there to watch. So that's another thing, you have to speak to them. It all depends on what they go to. I hardly go to YouTube, but when I go to YouTube, I'm probably going to learn one cuisine, one recipe or the other. So it all depends on what they go to YouTube to do. And that is where you have to come in as parents to guide them, to let them know what they can go to YouTube and learn how to read. They can go to YouTube and learn how to build machine. They can go to YouTube and learn, and learn a skill. How to make hair is on YouTube. How to do makeup is on YouTube. I think it's a lot of things to learn from YouTube, but I
Yeah,
still know that there are some negative aspects. So that's where you as a parent comes in to let them know the good and the bad.
yeah, that's true. And I think, like what our guest speaker said earlier, there should be boundaries. There should
Boundary.
be boundaries. Pay attention, set boundaries, and then pay attention. Watch. I'm not saying be on their neck 247, no, but be actively involved in your children's life, understand or know what they do. Now, I want us to go to Nigeria families because we're Nigerians and a lot of us have experienced some of these things growing up. Now, I know in many Nigerian homes, you see children or young ones behaving in a certain way, and then the parents say, "Oh, this child is very stubborn. This child is very stubborn." Or some people say, "Oh, are you sure this child is not possessed? Are you sure this child, rather than saying, no, this might be a mental health concern." So how can parents and community leaders, how can parents and leaders in the society shift from stigma to supportive responses without losing cultural and faith values?
Okay. That's a
Thank
very good question, Kenny. Um, that is really true what you just said. There's this too much stigma in our country, in Nigeria. We try to attribute a lot of, emotional distress to being stubborn, to being possessed. And this has affected the way the diagnosis of mental health conditions, to be honest. Because when the stigma is there, they start praying, they deviate, they don't follow the right channel to help the child. So what I'll say here is that as a parent, you have to start listening. You have to start listening to your child instead of labeling your child. Instead of labeling your child as being stubborn, as being possessed that needs deliverance, listen to that child. What is going on with your child? This child, you've known this child all your life, and suddenly something seems to be going wrong. Listen, have communication, talk with that child. Okay. And also, I'll say that the mosque, the church, the community should also not be judgmental. They should try as much as possible to start emphasizing mental health in these communities, in the church, in the mosque, and in the community. Emphasize mental health and not be judgmental, be supportive as much as possible. And I think if we do this, we listen to these children, support them, it will help.
Dr. Mary, I can't hear you. I can't hear you.
Can you hear me? You
Yeah, we
can
can
hear
hear
now.
you
Okay.
now.
So I've explained what it is to listen. The mosque, the church, the community have to work together to promote mental health, to talk more about mental health, children's mental health, and to support them as much as possible without being judgmental. That's what we should emphasize.
And that's absolutely true. That's absolutely true. And that's why as parents we need to, I know Dr. Mary said something about not settling for where you are. Develop yourself. Online, there are several courses on parenting. There are so many courses on parenting, different parenting styles, and the rest of it, how best to support your children. Because, like I say, you can't give what you don't have. If you don't even have a clue on how to support the child, then nothing, you can't actually support that child. And the child just grows up feeling unheld or, alone and just think that things are normal like that. And it's a whole lot going on. So, as parents, I think um parents should be intentional about developing themselves. Learn. It's not too late to learn. You keep learning and learning. In fact, Dr. Merritt, you've met with a lot of parents. You've met with children. Was there any time that a child had apart from most of the things that you said, and the parent listened to the child, the parent was there for the child, but just wasn't, no, not knowing how to support that child, where the parent kept struggling and struggling and struggling? What intervention was put in place to support that family? And then what do you have to say? Were there times that you met with a particular family, a parent that was there for the child, knew that something was wrong in the life of that child, took all of the steps that you have mentioned right now, and then nothing happened? What interventions were put in place to help support that family?
So, for that kind of situation, you've done all the best you can do for your child. Although I've not had that, contest, I've not had the situation of a child who the parents have done everything for, yet still went astray. And but what I'll say, if you have, as a parent, you have done your best, you've done everything you needed to do, seek professional help. You're a Christian, you say, oh, it's the church, I want to pray and cast and bind. Like I said, faith and science are not enemies. They can work together. So seek professional help. Take that child for therapy. Take that child for support. Take that child to see a psychologist or a psychiatrist. It might just be that the child is going through depression. It can just be that the child is having anxiety disorder, and having professionals manage this child can be of immense help. Okay, imagine a child that is depressed, who is having suicidal thoughts, suicidal ideation, can meet a psychiatrist, and with psychiatrist can help them either using the talking therapy, and if that is not working, can start medications. There are various medications that can help sort out a child that is depressed. There are medications that can help a child that is having psychosis, who is becoming aggressive, destroying things, and going, there are medications that can help. So in that situation, you've done all you're doing, and the child is not still acting the way you want to act, seek professional help. That professional help, it must not always end up in medication, can end up in just talking therapy. The psychologist being able to talk to the child, speak to the child, have sessions, and then the child will get better.
Thank you very much. I'll keep referring to Nigeria because we're Nigerians. Majority of us are Nigerians. Now, the thing is, what do you have to say to schools? Because I think it's a different thing entirely here. The way the school system is structured there is so different for what many of us experience back at home. You have that extra support. The moment a child is identified as having certain challenging behavior or whatever, there's that extra support. But in our Nigeria system, maybe some new schools have started doing that now, but you find out that a lot of schools do not, most of the teachers are not even well equipped. The school, they don't even have that experience in handling issues like this. What do you have to say to schools and other institutions? How can they help to provide immediate support to these children while they wait for professional help?
Yeah, Kenny, you're very correct. I'll say in Nigeria, we do not have that, that resources. We do not have the, mental health professionals to manage our children like we have here in the UK. But I believe that it takes a community. I think this is how it takes a community to raise a child. Okay, so what I'll say is the church who is directly involved in the child's life, the schools, the mosque, whatever society that parents are involved in, they need to step up, they need to do something. And what they can do is to train the key people heading this organization, especially a church. You can train pastors, or you can train youth leaders. You can train youth leaders. You can also train the imam. You can train community head to be to provide that counsel as counselors, as guidance to these youths, to these children. So you can train them to know more about mental health issues, train them to understand adolescents and how to manage them, train them to understand mental health illness. And so when these individuals are available in places like this, they will be able to help and support. Most times, psychiatrists, what they do is talking therapy. What is talking therapy? They call it cognitive behavioral therapy. When you hear it, it sounds so big, but it's more like they have a one-on-one talk, counseling sessions, and they are talking to you. So if we can train and equip these people, we can train and equip the pastors or the youth leaders, or in a school, you get someone and the person is made a guidance counselor for the youths and children. And when they are well trained, they have this foresight as to a child who is, beginning to manifest out of norm. When these people are in place and they are on standby, they will be able to support and help children when they see such situations. So that's what I would advise for Nigeria to help train our imam, pastors, and community leaders as much as possible on mental health issues to support our children.
Thank you very much. Thank you. Keep sending in your questions, suggestions. Muturayo Williams Johnson says, in a situation where parents have done that needed to be or what needed to be done, it means the affected parents failed to pay attention to the foundation. And if the foundation is destroyed, what can the righteous do? Only grace will help such a child. Let's pay attention to their foundation. She also said the socialization agents are there to train our children, but there are parents who will not support such system. I think that's why I encouraged, even our guest speaker has said the same thing, encouraging parents to be open to learning. When I know there are some parents that always want to resist. You tell your child that, or for example, imagine a school that has a specialist that has identified the need in the child and then says, oh, madam or sir, this child is experiencing certain things and we should, put certain measures in place to best support that child. Sometimes you find some parents that want to resist it. They will want to become very defensive and the rest of it. I think parents, we should be open to learning, and then, like I said, pay attention to the foundation. Pay attention to the foundation. Please, let's keep our questions coming in. Suggestions, questions. I'm sure a lot of us have had experiences with young ones. Sometimes you're trying, and it's like, is it that I'm not trying my best? Is it like I'm not getting so involved? You are doing so much to help that child be the child that you want him or her to be, but it's a big challenge. What do you do in that situation? Now, Dr. Merritt, how can, beyond responding to crisis, how can we build resilience in our children and teenagers so that they can better cope with all of this pressure, the social media influences, insecurity, the challenges even faced back in school and all of it? How can we help build resilience in our children so that they can better cope with these things?
Yeah, thank you very much for that question, Kenny. So, it's very, very important to build resilience in our children as much as possible. And how do we do this? There are a lot of ways we can do this, okay? First of all, the family bond should be there. Let the children know that you are there for them. You are very much available for them. You've got their back no matter what. Let them feel supported. Let them feel loved from home. That love from home is very, very important. So when the child is confident that their parents have got their support and they know that no matter what, they have their a backbone, is something that will give them, this support, this courage, and this resilience. Also teach them to have emotional intelligence, right? Let them know how to understand their emotions and also know how to express it. It's very important. Then also promote healthy behaviors. Your child should sleep at a particular time, 9 p.m. Your child should wake up at a particular time. Your child should eat this way. How to table manners. You're already teaching and inculcating these habits in your child. Or you have to tell them physical activities is important for your health. You're training your child to be involved, to do physical activities. This is something that is very important that you can, impart on your child. And also you have to teach your children how to sort out their problems. You don't have to do everything for them. Anything you want to do it. Anything you want to do, then let them gain control. Let them be able to do something for themselves. And when they have that independence, they will be able to survive the outside world. It's very important to allow them. Let them fail. Even when they fail, they learn on it. It's not a bad thing to fail. But when you fail, you rise up immediately and do it better. So allow your children to learn and unlearn, and that is another way to help create resilience in them. Another thing is to be a positive role model to your children. Let them see how you're fighting things, how you're building your life, and how I think as parents, we are the greatest role model our children can ever have. You see some children that are well established today. If you ask them who their role models are, they will say their parents. I watched how my mom did this. I watched how my dad did this. Be that positive role model to your children, and it's going to help a lot. Let them see how you had a challenge, how you were able to solve it, how you were able to accomplish it. Like if I'm having a challenge, I share it with my children, and when at the end of the day I solve it, I'll come and tell them, hey, all of us we dance. They are happy. Do you get? So these are the things you should do. So be a positive role model to your children. Yeah, with this way they will grow up and you have the best of children. So a child that is taught to sleep at this particular time, this is when to wake up. When you wake up, maybe you pray, or this is how to eat. When that child grows up, that child will always remember this is how it is done. They follow that pattern. So the child will not suddenly grow up tomorrow and start doing the opposite, because you have already trained that child from the grassroots.
Hmm. Thank you so much. Thank you so much. We have just few minutes left. Dr. Merritt, what do
Yeah.
you have to say in 2, 3 minutes? What do you have to say to our audience?
Okay. What I have to say is that, first of all, it's not easy to raise a child. I have got 3 children. I know how difficult it is. I know the struggles involved. But as parents, we have to be available for our children. You have to learn how to communicate with your children. You have to know your children even more than they know themselves. So know them very well, so that when things start going the other way, when they start acting out of control, you will be the first to pick it. And as soon as you pick it, you nip it at the bud before it starts going out of proportion. Do you understand? So if you know them very well and suddenly you start noticing that they're going out of proportion, you have to come in and you help them. Okay. And another thing, lastly, if you've done all you can do and it's not working, seek professional help. There are people who have gone to school and spent 6 years, 8 years in school and have done extra training in managing such situations. So meet them to help you. All right. Don't say, oh, I'm a Christian. I don't know. I need to cast and bind. No, no, no. Like I said, and I will say it again, faith and science are intertwined. So they are working together synergistically together to make the human life better. So try to seek professional help. Thank you very much.
Thank you, thank you, thank you. Don't mind me. I like clapping. Oh. I think another round of applause
Thank
for our
you
speaker.
too.
Thank you so much. Thank you
Thank
so much.
you. Thank
In fact,
you.
I saw a write-up somewhere. I saw a quote somewhere, and I wrote it down. It said, "Every child is one caring adult away from being a success story."
Mm-hmm.
Every child is one caring adult away from being a success story. So whatever it is that you're struggling with in terms of the child's behavior or don't give up on that child. There is no one or no situation that can change. So as parents, let's be intentional, let's be involved in their lives, and God will help us. So once again, a round of applause to our guest speaker. Thank you so much for
All right.
making
Thank you
time.
very much once
Thank
again
you,
for this
thank you, thank
opportunity,
you.
Kelly. I thank you,
Thank
Rosemary. All right.
Thank you so
Bye.
much. Thank you.
Thank you so much, Doctor. I'm sorry, it's been a very busy week, and I want to really say thank you for being a very busy professional yourself. Thank you for this huge sacrifice. We do not take it for granted. I listened with rapt attention, even though I was kind of moving about. But I want to say thank you so much. I'm going back to listen again and to glean from the knowledge that you have shared today. Thank you so much, Ma. We do appreciate. And please, as we always say, keep your door open for us. We might be coming. We are Oliver Twist. We might be coming back.
No
Thank you
problem.
so much, Ma. Thank
All
you so
right.
much.
Thank you. Thank you too. Bye.
Thank you so much, everyone, for a beautiful and informative, therapeutic, helpful Saturday. I'm sorry, I was a bit tired, and but thank you, Barrister Ifiche, for being a great host. And until we come your way next week, Saturday, stay blessed. Have a great weekend. Bye.
Bye.